episode 74 of the Real World Wellness Podcast. Hi everyone, I'm Christine Lehman, a nutritional therapy practitioner and the reverse diabetes coach, which is also the name of my website. I see clients in person and remotely, meaning by Skype or an online platform that I like, and I'm accepting a limited number of clients starting in March. You can reach me using my contact form on my website or directly at Christine, Christine, at reversediabetescoach.com. Please remember while you're listening to the show, advice and information we provide is intended to be helpful and informative, but is not a substitute for medical advice or treatment. So, for those of you who've been listening to the last episode, which was 73, this is a two-part series on lessons learned from a broken wrist. So this is pretty personal. Just to recap, broke my wrist, my left wrist, complete break in the radial bone that goes along your forearm from your sort of the thumb area down to your forearm. 3 weeks ago when I was ice skating, and I knew the minute I stuck my left hand out that I had broken my wrist. I just, I'm in tune with my body, which is a good thing, but it was very painful. And the reset, unfortunately, you always want to try to reset it. You can do that non-invasively without surgery. So that was my first choice, and an orthopedic specialist did that in the ER, but unfortunately it didn't work. So I've had to have surgery and a titanium plate and screws put in. And then I was in a cast. He took the cast off when he performed surgery, of course, and then put on a splint. So I've been wearing that for a couple weeks, which gave me a fair amount of support, plus a sling that I kept my left arm in. And so I was able to manage the pain pretty well, and I've been doing meditation. You may or may not know that I practice Tibetan Buddhism. So I do know from previous experience that meditation, especially daily meditation, and even chanting, saying mantras and so on, can help bring your blood pressure down. There's evidence to support this, and I've seen it in my own life. So I've been doing that. I didn't want to really get too hooked on the painkillers, and I've been able to bring my numbers down, frankly, some days even into the normal range. But today I want to talk in part 2 more about pain and managing pain, because since I did my follow-up visit with the orthopedic specialist, first of all, the good news is that the x-rays look really good. When you do have a titanium plate and screws put in, there's always a little risk of infection. So there is no infection, and everything is healing very well. It's in alignment. But when he took the splint off and then told me not to wear the sling, my pain level has gone up a lot, because there are two things that happen. One, you lose the support of the splint, which is more sturdy, just more layers. It was a lot of gauze and then kept in place with an ace bandage. If you've ever had a brace, it's something you slip on and off whatever body part or your wrist. A lot of people wear one sometimes on a wrist or even on a knee if they're injured their knee or foot. So it's pretty easy to get on and off, and it's sort of the minimal support. So I've had to get used to less support, and therefore, and also my circulation. The good news, I guess, is that your blood circulation increases, but the bad news is that you feel more pain. So the result of getting the brace put on and the splint taken off is that I have been in much more pain. So then the question is, how do you manage the pain? And so I have been taking oxycodone, which is an opioid, and it is a narcotic, so of course it has to be prescribed. It should always be, authorized by a doctor. And I had limited myself to taking just, like half a pill at night, and was doing great until until this week, where in other words, I didn't feel I needed to take it during the day. I can manage the pain just, with my meditation and some Motrin and so on. But I have to admit, this week, when I went to the doctor, I almost passed out in his office, and my blood pressure has gone up, and we'll talk about that in a minute. It varies. Even today, I took it again this morning. The top number was pretty good, but the bottom number, which I'll explain a little later in the podcast, is still too high. So we'll talk about that in a minute. But going back to oxycodone, what I've had to do to manage the pain is just accept that I need to take it during the day. Frankly, I took a quarter of a pill just before I started broadcasting here, because I've been out of the sling holding my arm in different positions for about a couple hours now, and I find that's about as long as I can take before the pain really kicks in. So I'm trying to also not only keep my arm out of the sling for a minimum of 3 or 4 hours a day, but also do these exercises, which don't bother me as much as just not having the sling and I guess the splint for support. The other thing I want to mention is I will be starting physical therapy next week, and all my friends who've, not too many of them, thank God, have been through something similar, but they've told me it's pretty painful in the beginning. So I'm going to be taking Motrin and a little bit of oxycodone just to help with that. But again, I take a low dose because, I find if I take, if you want to be somewhat alert, a quarter of a tablet of the oxycodone is about right for me. And I realize it's an individual matter. If I plan on resting, which I've had to do a bit more, and frankly, you should rest when something like this happens, I'll take half a pill and then lie down. It doesn't mean you have to sleep the whole time, but you should be lying down. And in my case, that's what I find, because that's the amount that kind of makes me drowsy. And then the other thing to keep in mind with oxycodone is it takes about 30 minutes to kick in. So in terms of timing that. So again, pain, I've been thinking about pain more. What is it? What is it trying to tell you? I'm no expert on it, but certainly it's your body's way of signaling that, something needs attention, I think. It's kind of we tend to want to pay attention to it. It's always feels like something's wrong. But in a way, yes, there is something wrong in that my wrist is still, the plate's there, but it's still, I guess, technically broken. Everything is aligned now. So I guess, it's in the healing process. So I guess another way to kind of frame or think about pain is it is part of the healing process that you have to go through. Again, my circulation's better, but, retraining my arm, my wrist is much, there's been some atrophy there of the muscles. When I take the brace off, I can see that. And there's a lot of swelling still and bruising, but that is all normal, and even the pain is normal after I had to call the nurse, because frankly, I was a little disappointed the doctor didn't tell me what to expect with the pain. And I think it's very important for the medical profession to have a conversation with you about pain so you know what to expect, because I thought it was going to get better with the brace on, not worse, in terms of both mobility and the pain going down, but that hasn't been the case. So the other thing I'm learning is to kind of not expect myself to be without this sling necessarily the entire day, but to kind of do this gradually, where I'm like 2 hours without the sling, 2 hours with the sling. And of course, you don't need a sling when you're sleeping. You prop your arm up on pillows. Same thing when you're lying down, or the other thing I have to do is ice my wrist and my hand, the part that isn't in the brace. The doctor wants me to keep the brace on all the time except when I take a shower. And the other thing that has happened is that my blood pressure has gone up. I did buy a blood pressure cuff, And I noticed that I wasn't feeling well. 2 times it's gone up. One has been right after the visit to the doctor. And, some people get stressed out by visiting the doctor. There's actually a name for it called the white coat syndrome. So, partly it could be anticipation. You may be a bit nervous. So sometimes your blood pressure will be higher anyway in the doctor's office. But I took it they actually didn't take it, which I was a little surprised. This is the follow-up orthopedic visit that I had this week to remove the splint. And so I have this machine I mentioned last time. The brand name is Omron, and it's digital. And really, the hardest thing for me right now is to wrap the cuff around my right arm because, as you know, I'm very limited mobility with my left arm. So I've actually had friends. My joke, get the cuff in place, and then it's all digital. You just press start, and the thing inflates by itself, and then it takes a minute or two, but it'll give you your reading of your numbers, and I want to explain what the numbers mean in a minute. So the other thing is pain. Your blood pressure reacts to stress, and I'm assuming that my body is reacting or interpreting pain as a stressor. Makes sense, right? There's all different kinds of stressors. This happens to be physical. There's emotional stress. If you've ever been upset and then taken your blood pressure, often it goes up. So, the natural ways that I try to keep calm, of course, is through meditation and visualization. I even have a statue of healing or medicine Buddha, and I look at that and do deep breathing. The other piece of this is deep breathing. So even though I have started to take a little bit of blood pressure medication, that doesn't mean I throw out my natural methods. It's really meant to be complementary. So I am still doing, my meditation and the deep breathing. In fact, the practice that we use in Tibetan Buddhism is called calm abiding, or shamatha. So I have been tracking my blood pressure numbers, and the good news is I was able to get it in the normal range a couple times this past week, but then it's really been fluctuating, and I was concerned when the lower number, which is called the diastolic number, there are 2 numbers, and I will give you a primer on this. The top number is your systolic number, and the bottom number is your diastolic number. And I'll tell you what normal should be in a second, but I have, frankly, a handout here that I want to get to explain what blood pressure is. So the top number, the systolic number, is when your heart beats, it squeezes and pushes blood through your arteries to the rest of your body. This force creates pressure on those blood vessels, and that's your systolic blood pressure. A normal systolic blood pressure is below 120. So for me, this week, mine has fluctuated, the systolic number, from 159 to a low of 118. That was actually January 31st to the 7th. And then this week, up until today, which is the 12th, the low has been 135. I'm sorry, 123 was this morning, which I was pleased about. But yesterday, this shows what I'm talking about with the fluctuation, it was 162. So believe it or not, it's dropped 40 points just overnight. But the systolic number, which, to be honest, I tend to pay more attention to the top number, but I've had to learn to pay attention to the bottom number as well. Going back though for a minute to the systolic blood pressure number, again, normal is below 120. Again, my normal blood pressure before this, I broke my wrist, is 112, which is very good. And then the diastolic, and then high blood pressure with your systolic number is anything above 120. But really, there's stages or categories of this. It's 120 to 139. You're considered pre-hypertension or borderline. It's similar to concept to diabetes. There's borderline. And then high blood pressure, they have stage 1 is 140 to 159. Stage 2 is 160 or higher. So really, once you climb to that point, you really, really should consider medication if you can't, and or bringing it down naturally. A crisis, which you want to avoid, is higher than 180. So that's your systolic number. The upper number, sorry, my cat's bothering me here. And then the lower number, the diastolic blood pressure number, is that bottom number, which signifies or represents the pressure in the arteries when the heart rests between beats. And this is the time when the heart fills with blood and gets oxygen. And a normal systolic or diastolic blood pressure is lower than 80. Anything above 80 is 80 to 89 is considered hypertension. Pre-hypertension. Anything above 90 is definitely considered high blood pressure. Again, the stages are stage 1, 90 to 99, stage 2, 100 or higher. And then a crisis is higher than 110. And there's some charts you can just get online. If I can, I'll try and include a link to this chart that I printed out, which is helpful. So that's my primer on blood pressure numbers. And also, obviously to know what your blood pressure is, you need to monitor it. So it is handy to have, a blood pressure machine, a digital machine, because it's so much easier than the manual kind. And the accuracy, I think, has improved. So when I noticed that my diastolic number was inching up to 95, which definitely puts me squarely in the stage 1 of high blood pressure, plus the upper numbers on the systolic were kind of, some days were hitting that too. I called my primary care doc, and she actually was a little more concerned about the diastolic number getting closer to 100, and that's when she prescribed a very low dose, 5 milligrams of amylin. I'm probably butchering the name, but the brand name is Norvasc, Norvasc, and the drug name is amlodipine mesylate. Sorry, I'm having a little trouble pronouncing that today. Now, the reason I wanted to try and do this naturally is because, of course, there's some side effects to blood pressure medications. But it's still, again, if your numbers are getting high and you can't completely control it naturally, then, it's time to consider something. So the side effects of this blood pressure medication include dizziness, feeling of faintness, and also swollen ankles, which didn't appeal to me at all. So, of course, I waited a good week to see if I could, a week and a half, frankly, before I finally felt maybe I needed to take it. Because, again, with this transition from the splint to the brace and the lack of the sling and my numbers getting up to, on 2 days ago, it was 162 systolic over 100, and that kind of scared me a little. So I have started taking this just in the evening because of the side effects. So who wants to be, dizzy during the day? That's the only thing I've noticed that so far, is that it can make me feel a little dizzy. So the prudent thing is to take it at night before you go to bed. I actually always like to try medications. I mean, believe me, I don't take hardly any, but if I have to, I prefer taking it in the evening, just in case there are side effects. It won't affect me so much. So the good news is I haven't had any swollen ankles or any of that, but the downside is that the dose might be a little bit too low, because when that reading of 162 over 100 was after I started taking the medication. So now I'm considering talking with my doctor to see whether, for now, again, and I want to emphasize this is just a temporary thing for me until, my wrist heals more. whether we should just double it to 10 milligrams in the evening. So I will have that conversation, but the good news is just overnight, the top number, as I said, came down quite a bit. Just resting, and getting a good night's sleep, and really helps. So, the other thing I wanted to say was that there are other reasons why your blood pressure can go up. It's not, in my case, I think this is being driven primarily by the pain. So I wanted to spend a little bit more time on other reasons for your blood pressure to go up. And I was talking briefly about medications and supplements that can raise your blood pressure. So I'm going to just run through the list here, starting with pain medications. So I already mentioned nonsteroidal anti-inflammatory drugs, or NSAIDs. Other ones besides Motrin, which is the brand name for ibuprofen, of course, are Advil. And then there's also, in this category of NSAIDs, Aleve and Naprox, which contain naproxen sodium. In addition to NSAIDs, there's endomethacin, which goes by Indocin. There's piroxicam, which goes by the brand name of Feldene. Just bear with me, I'm scrolling down here on my computer. So that's the pain meds. You should again have your blood pressure checked regularly, and I do recommend buying a digital cuff and machine to do it at home. So you want to figure out which pain medication is best for you. Frankly, I am kind of sticking with the low dose of oxycodone, and I found that to be a little more effective anyway than the Motrin, and that way I don't also have to worry about that increasing my blood pressure. So let's talk about antidepressants. We know that can change your body's response to brain chemicals, including serotonin, norepinephrine, and dopamine, that affect your mood. These chemicals may also cause your blood pressure to increase. So examples of antidepressants that can raise your blood pressure include, again, I'm going to read both the generic name and then the brand name. So venlafaxine, which goes by the brand name of Effexor XR, monoamine. Now these are old. They're called MAO inhibitors, monoamine oxidase inhibitors. Then there's the tricyclic antidepressants. So these are definitely older generation of antidepressants. And then the newer ones are fluoxetine, goes by the brand name Prozac, Serafem, and others. So it's best to check with your doctor and also to check your blood pressure regularly if you take antidepressants. If your blood pressure increases or isn't well controlled, you can also ask your doctor about alternatives to these medications. I think doctors are getting more in tune with lifestyle changes, but again, you can try. I certainly recommend meditation regardless of whether your blood pressure is up or not, but it is a good way, I think, to control your high blood pressure. So, you don't have to rely ideally on medications, but our medications and doing lifestyle changes is also a good approach. Birth control pills, so which we know affect your hormones. So birth control pills and other hormonal birth control devices containing hormones that may increase your blood pressure by narrowing your smaller blood vessels. So virtually all birth control pills, patches, and vaginal rings come with warnings that high blood pressure may be a side effect. The risk of high blood pressure is greater if you're older than age 35, overweight, or a smoker. Not all women will have increased blood pressure from using birth control pills, but if you're concerned, again, have your blood pressure checked at least every 6 to 12 months. And we all know if you go for an annual physical, and emphasis on the word annual, right? You're going every 12 months. It's just routine that they'll check your blood pressure. Another option, if you don't want to buy the cuff just yet, is most pharmacies like CVS, obviously, which is a chain, It's very popular here in the East Coast. They have blood pressure machines that you can just go and get tested when you're there at the pharmacy. So I would, that's another option for you. Another thing to keep in mind about the birth control pills is if you already have high blood pressure, you might want to consider using a different form. While nearly all birth control pills can raise your blood pressure may be less likely to increase if you use a birth control pill or device that contains a lower dose of estrogen. So again, what's driving the increase in blood pressure is the amount of hormones in the pills or devices, in particular estrogen. So caffeine, that's one of my favorites. This is actually, the jury's out on this. So I do not drink much caffeine. I have been drinking a little. Mainly the reason I like it in the winter is because it's warm, but I do about a third caffeine in terms of the ratio to Dandy Blend. So for those of you who are not familiar with Dandy Blend, it's a great coffee alternative. So it doesn't have caffeine, but it has like dandelion and chicory and one other extract from root vegetables. For those of you who visited New Orleans, they have this wonderful chicory flavor in their coffee. They use chicory root, and I like that. So if you like that, you would like Dandy Blend. Of course, it's mainly using dandelion extracts, and it is gluten-free. So my ratio is 2/3 of Dandy Blend, and it's a powder, and it goes right in your coffee filter. And you can use your regular coffee machine for that. It's ground, obviously, already. I like the powder. And then I use like a third of the Colombian, and I like the medium roast Colombian coffee, so I'll do like a third to 2/3 of coffee to 2/3 of Dandy Blend. So, I use about a tablespoon of each, so 2 tablespoons of Dandy Blend and 1 of the caffeine. So let's talk more about caffeine. Consuming 200 to 300 milligrams of caffeine can temporarily cause a spike in your blood pressure, but it's unclear whether the effect is temporary, long-lasting. So they seem to think that it can temporarily increase your blood pressure by blocking a hormone that keeps your blood vessels widen, allowing blood to easily flow through them, which probably makes sense of why it has that alert sort of effect on people. In addition, caffeine may cause you to produce more cortisol and adrenaline, which makes your blood flow faster, thus increasing your blood pressure. However, there isn't enough evidence to prove that caffeine raises your blood pressure long term. So it may be kind of an ebb and flow thing during the day. I don't recommend this, certain caffeine containing medications and products. I would avoid those, like caffeine pills, energy drinks, and other beverages that have become somewhat popular. Some studies suggest that coffee may contain a substance that lowers blood pressure, thus counteracting any effects from caffeine. In addition, the caffeine content of coffee can vary widely, so it's difficult to say how many cups of coffee you can drink a day. To see if caffeine raises your blood pressure, check your blood pressure about 30 minutes after drinking a cup of coffee or another caffeinated beverage you regularly drink. If your blood pressure increases by 5 to 10 points, you may be sensitive to the blood pressure raising effects of caffeine. So that would be an interesting experiment to conduct on yourself. So moving on to cold medicines, decongestants narrow your blood vessels, which make it harder for your blood to flow through them. So you don't want that. That increases the blood pressure. Decongestants may also make some blood pressure medications less effective. So examples of these are I'm just going to tell you the brand name, Sudafed, which I'm sure you've heard of. The other one is neosynephrine. So check the label of your cold or allergy medication to see if it contains a decongestant. If you have high blood pressure, you're better off avoiding decongestants. And again, you can ask your doctor or pharmacist about alternatives for people with high blood pressure. So let's talk about herbal supplements, because this is right up my alley as a holistic nutritionist. Again, best practice is to always tell your doctor, anyone who's treating you, about any herbal supplements you're taking or considering taking, to see if the supplement could raise your blood pressure or interact with blood pressure medications. I really want to emphasize that interaction is very important for doctors to know about, as well as any alternative medicine practitioner you see. I mean, that is part of the medical history. I want to know not only what medications you're taking, but I want to know what supplements you're taking. So here's some examples of supplements that can affect your blood pressure or blood pressure medications. So arnica, bitter orange, ephedra, ginkgo, which goes by ginkgo biloba, ginseng, maybe limited to certain kinds, guarana, licorice, senna, and St. John's wort. So people always think herbal, because it's natural, that they're always safe, but you want to check with your doctor, certainly if you have high blood pressure, to make sure. A good practitioner will cross-reference. This is what I do. If somebody comes to me with a list of medications they're on, and I'm considering ordering a supplement for them, I will cross-reference with their medications to make sure that there's no interactions. And a good practitioner will do that, but to be on the safe side, you may want to also discuss this with your doctor before taking herbal supplements. Immunosuppressants. So some immunosuppressants can raise your blood pressure, possibly because of the way they affect your kidneys. Examples that can raise your blood pressure include cyclosporine. It goes by the brand name Neoral, Neoral, Sandimune. Taclominis is the generic, and the brand name is Prograf, Prograf. So again, have your blood pressure checked regularly. You want to ask about alternatives to these medications if necessary. Stimulants such as methylphenidate, which goes by the brand name Ritalin, can cause your heartbeat faster or irregularly, raising your blood pressure. So you want to have your blood pressure, again, through whether any kinds of these medications are over-the-counter drugs. If you're taking them, you need to check your blood pressure regularly. And I would hope you're not taking illegal drugs, but we will just say that, of course, examples of illegal drugs that can affect your heart include amphetamines, anabolic steroids, and cocaine. So you should stop anyway just because they're illegal, but this is another reason to stop. It can really mess with your heart rate and damage your heart muscles. So I'm going to just close out now and emphasize how important it is to to monitor your blood pressure, and whether you're, in my case, I did buy the machine, and to always be very cautious about any medication, to understand the side effects, to check with your doctor, to let your doctor know you're taking any herbal supplements. And the good news is that combined with lifestyle changes, or always, or just starting with lifestyle changes, you can bring your blood pressure down. Usually, I think of it incrementally. So if you were, let's say, high blood pressure, your goal, stage 2, you want to get to stage 1. If you're stage 1, you want to get it to the pre-hypertension stage, but your ultimate goal would be the normal stage. And which is not something that happens overnight. I know that when I made the lifestyle changes and started practicing Tibetan Buddhism with the chanting and the meditation, that I was able to get my blood pressure down from what I realize now is more the pre-hypertensive stage to the normal, to even below. The top number is usually 112, which is really good. So, again, and I'm middle-aged, quite frankly. So, I'm glad that for me, the other thing I'm very happy about is that I'm fully confident that as the pain becomes less and I heal through physical therapy in the next couple weeks in March, that I will be able to get off the blood pressure medication and the oxycodone. I don't want to be on either one long term. So I view this as a temporary thing, and I look forward to giving you an update about where I am with physical therapy soon. But I do want to mention before I close out today that I'm really excited for my next episode to have a guest. You may have heard of her, Dr. Sarah Ballantyne with a B. I know Valentine's Day is coming up, not to get confused with that. And she is a PhD and scientist and researcher. And you may know her as the Paleo Mom, Sarah Ballantyne. She is the blogger behind the award-winning blog, thepaleomom.com, co-host of the top-rated and syndicated The Paleo View podcast, and New York Times bestselling author of The Paleo Approach to the Autoimmune Protocol. And then she has a companion cookbook out, and then another cookbook called The Healing Kitchen. And I'm looking forward to talking with her about all of the above. And so you really want to stay tuned for that podcast, which I plan to have posted next Friday. So I'll be interviewing her on the podcast on Thursday, and then I would like to get it out the following day. So that will be episode 75. Stay tuned, everyone, for that. Have a great, healthy week, and thanks, everyone, for listening.